Question 1. A nurse accidentally administers the wrong medication to a patient. The patient is stable and shows no adverse reaction. What is the ethical action for the nurse to take? A. Keep quiet since no harm occurred. B. Notify the physician and complete an incident report. C. Wait until the patient complains before reporting. D. Tell the patient's family first. Answer: B. Notify the physician and complete an incident report. Rationale. Ethical nursing practice requires honesty and accountability. Even if no harm occurs, errors must be reported according to facility policy. This supports veracity, truth-telling, and accountability. Strategy: always choose options that demonstrate honesty, safety, and proper reporting. Question 2. A terminally ill patient refuses further chemotherapy. The nurse respects the patient's choice. Which ethical principle is being applied? A. Beneficence. B. Autonomy. C. Non-maleficence. D. Justice. Answer: B. Autonomy. Rationale. Autonomy means respecting the patient's right to make their own decisions about care, even if it differs from the nurse's or physician's recommendation. Strategy: look for options emphasizing respect for patient choice. Question 3. A nurse observes another nurse documenting care that was not provided. The observing nurse should: A. Ignore it since it's not her patient. B. Report the incident to the nurse manager. C. Confront the nurse publicly. D. Tell other staff members. Answer: B. Report the incident to the nurse manager. Rationale. This is ethical whistleblowing and upholds fidelity and accountability. Reporting through the chain of command prevents harm and maintains professional integrity. Strategy: when misconduct is seen, use the proper reporting channel. Question 4. The nurse explains a procedure to a patient but the patient refuses. The nurse insists, saying, "You'll regret it if you don't do this." What ethical principle is violated? A. Autonomy. B. Justice. C. Fidelity. D. Beneficence. Answer: A. Autonomy. Rationale. Coercing or manipulating a patient violates their right to self-determination, autonomy. Strategy: watch for any wording suggesting pressure or force that violates autonomy. Question 5. A nurse is caring for two patients in pain. One has a chronic condition, the other acute injury. The nurse gives both equal attention and care. Which ethical principle is demonstrated? A. Justice. B. Beneficence. C. Fidelity. D. Autonomy. Answer: A. Justice. Rationale. Justice means fairness and equality in care delivery. Every patient deserves fair treatment regardless of their condition or background. Strategy: fairness equals justice. Question 6. A nurse refuses to participate in an abortion due to personal beliefs. What ethical right is being exercised? A. Autonomy. B. Fidelity. C. Moral integrity/conscientious objection. D. Beneficence. Answer: C. Moral integrity/conscientious objection. Rationale. Nurses have the right to decline participation in procedures that violate their personal. Question 7. A nurse tells a patient's friend about their diagnosis. What ethical principle is violated? A. Justice. B. Fidelity. C. Confidentiality. D. Autonomy. Answer: C. Confidentiality. Rationale. Sharing patient information without consent violates HIPAA and ethical confidentiality principles. Strategy: any disclosure of patient information to unauthorized persons is a violation. Question 8. When a nurse advocates for a patient's right to pain management, the nurse is demonstrating: A. Non-maleficence. B. Justice. C. Beneficence. D. Advocacy. Answer: D. Advocacy. Rationale. Advocacy involves standing up for the patient's needs, preferences, and rights. Strategy: if the question involves speaking up or protecting patient rights, think advocacy. Question 9. A nurse overhears another nurse making fun of a patient's accent. The appropriate action is to: A. Ignore the situation. B. Join in the conversation. C. Report the behavior to the supervisor. D. Laugh to avoid conflict. Answer: C. Report the behavior to the supervisor. Rationale. Discrimination or disrespect toward patients is unethical and unprofessional. Reporting maintains integrity and promotes a culture of respect. Strategy: protect the dignity and respect of all patients. Question 10. Which ethical principle requires nurses to do no harm? A. Justice. B. Autonomy. C. Non-maleficence. D. Beneficence. Answer: C. Non-maleficence. Rationale. Non-maleficence means avoiding harm to patients physically, emotionally, or psychologically. Strategy: do no harm. Non-maleficence. Question 11. A nurse provides emotional support to a patient after delivering bad news. This demonstrates A. Justice. B. Fidelity. C. Beneficence. D. Veracity. Answer: C. Beneficence. Rationale. Beneficence means doing good or promoting the well-being of patients. Strategy: when kindness or compassion is shown, it's beneficence. Question 12. A nurse tells the truth even when the information is uncomfortable. This reflects which principle? A. Veracity. B. Autonomy. C. Beneficence. D. Fidelity. Answer: A. Veracity. Rationale. Veracity equals truth-telling. It builds trust and ethical relationships. Strategy: honesty equals veracity. Question 13. The nurse assigns a nursing assistant to perform wound care. This violates the ethical principle of A. Justice. B. Autonomy. C. Beneficence. D. Non-maleficence. Answer: D. Non-maleficence. Rationale. Delegating tasks beyond the assistant's scope can harm the patient, violating do no harm. Strategy: delegation questions focus on patient safety. Question 14. A nurse keeps a promise to call a patient's family after surgery. This demonstrates A. Fidelity. B. Veracity. C. Justice. D. Autonomy. Answer: A. Fidelity. Rationale. Fidelity means keeping promises and maintaining trust. Strategy: keeping promise equals fidelity. Question 15. When the nurse ensures informed consent is signed before surgery, this shows respect for A. Autonomy. B. Beneficence. C. Fidelity. D. Justice. Answer: A. Autonomy. Rationale. Informed consent protects patients' right to choose. Autonomy. Strategy: any question about informed consent. Autonomy. Question 16. A nurse gives information to a patient about available support groups after a new cancer diagnosis. Which ethical principle is demonstrated? A. Justice. B. Veracity. C. Beneficence. D. Autonomy. Answer: C. Beneficence. Rationale. Providing helpful resources promotes the patient's well-being, the essence of beneficence, doing good. Strategy: choose answers that show doing what's best for the patient. Question 17. A nurse refuses to falsify a patient's chart even when pressured by a coworker. Which ethical principle is upheld? A. Fidelity. B. Justice. C. Veracity. D. Accountability. Answer: D. Accountability. Rationale. Accountability means being answerable for one's actions. The nurse protects professional integrity by refusing unethical behavior. Strategy: if the nurse takes responsibility or refuses wrongdoing, it's accountability. Question 18. A confused patient keeps removing their oxygen. The nurse applies soft wrist restraints without a provider order. Which ethical principle is violated? A. Autonomy. B. Fidelity. C. Justice. D. Veracity. Answer: A. Autonomy. Rationale. Restraining a patient without consent or a provider order violates autonomy and legal regulations. Strategy: always ensure patient consent or valid orders before restraints. Question 19. A nurse documents a medication error in the patient's chart and files an incident report. What principle is applied? A. Justice. B. Veracity. C. Fidelity. D. Non-maleficence. Answer: B. Veracity. Rationale. Truth-telling, veracity, requires honest documentation and reporting to promote transparency and patient safety. Strategy: honest documentation equals veracity. Question 20. A nurse supports a terminally ill patient who chooses hospice care. Which principle guides this action? A. Non-maleficence. B. Autonomy. C. Fidelity. D. Justice. Answer: B. Autonomy. Rationale: respecting a patient's end-of-life choice shows autonomy. Nurses must support the patient's right to self-determination. Strategy: respect for decision-making equals autonomy. Question 21. The nurse advocates for language interpretation services for a non-English speaking patient. What ethical concept is applied? A. Justice. B. Veracity. C. Beneficence. D. Fidelity. Answer: A. Justice. Rationale: justice means ensuring fairness and equality in care. Providing interpretation ensures equal access. Strategy: equal access or fairness equals justice. Question 22. A nurse cares for a prisoner with the same compassion as any other patient. Which principle is demonstrated? A. Fidelity. B. Justice. C. Veracity. D. Autonomy. Answer: B. Justice. Rationale: all patients deserve fair, equal care regardless of social status or crime history. Strategy: treating everyone equally justice. Question 23. A nurse witnesses a physician yelling at a patient. What is the best ethical response? A. Ignore the behavior. B. Support the patient and report the incident. C. Record the situation in the patient's chart. D. Discuss it with another nurse. Answer: B. Support the patient and report the incident. Rationale: ethical nurses protect patient dignity and report abusive or disrespectful behavior. Strategy: always act to protect patient dignity and safety. Question 24. A nurse receives a patient assignment beyond their competency. What should the nurse do first? A. Attempt it with help. B. Refuse and explain the reason to the supervisor. C. Call another nurse. D. Do it anyway to avoid conflict. Answer: B. Refuse and explain the reason to the supervisor. Rationale: ethical responsibility includes practicing within one's scope to prevent harm, non-maleficence. Strategy: when safety or scope is in question, refuse safely and report. Question 25. The nurse provides patient information only to team members involved in care. Which principle is followed? A. Veracity. B. Confidentiality. C. Beneficence. D. Autonomy. Answer: B. Confidentiality. Rationale: confidentiality means safeguarding patient information and sharing only with authorized individuals. Strategy: information protection, confidentiality. Question 26. A nurse promises to check back with a patient in pain but forgets. Which principle is violated? A. Fidelity. B. Justice. C. Beneficence. D. Veracity. Answer: A. Fidelity. Rationale: fidelity is about keeping promises. Failure to follow through erodes trust. Strategy: breaking a promise equals violation of fidelity. Question 27. The nurse explains to a patient the side effects of a medication before administering it. Which ethical principle is applied? A. Justice. B. Beneficence. C. Veracity. D. Autonomy. Answer: C. Veracity. Rationale: providing truthful information promotes informed decision-making. Strategy: honesty with information, veracity. Question 28. A nurse must choose which patient to see first during a crisis. What ethical principle guides this action? A. Justice. B. Beneficence. C. Fidelity. D. Autonomy. Answer: A. Justice. Rationale: justice ensures fair and equitable distribution of care based on need and urgency. Strategy: fairness and prioritization equals justice. Question 29. A nurse allows a patient to pray before treatment. What ethical principle is shown? A. Fidelity. B. Autonomy. C. Veracity. D. Beneficence. Answer: B. Autonomy. Rationale: respecting spiritual or cultural beliefs supports autonomy and holistic care. Strategy: respecting patient beliefs or rituals, autonomy. Question 30. A nurse delays giving a pain medication because she is busy chatting. What principle is violated? A. Justice. B. Beneficence. C. Fidelity. D. Non-maleficence. Answer: D. Non-maleficence. Rationale: neglecting to relieve pain causes unnecessary suffering, a form of harm. Strategy: always consider patient comfort and safety first. Question 31. The nurse reports a coworker suspected of working while intoxicated. Which principle is followed? A. Fidelity. B. Accountability. C. Veracity. D. Beneficence. Answer: B. Accountability. Rationale: reporting unsafe practice protects patients and the profession. Accountability ensures ethical responsibility. Strategy: reporting unsafe actions equals accountability. Question 32. When the nurse explains all treatment options, including ones the hospital does not offer, this supports A. Beneficence. B. Justice. C. Veracity. D. Autonomy. Answer: C. Veracity. Rationale: truth-telling builds trust and allows informed choice. Strategy: full disclosure, veracity. Question 33. A nurse refuses to gossip about a patient with colleagues. Which principle is upheld? A. Fidelity. B. Confidentiality. C. Beneficence. D. Autonomy. Answer: B. Confidentiality. Rationale: patient information must remain private, even in casual settings. Strategy: not sharing private information equals confidentiality. Question 34. A nurse allows a patient to make decisions about their diet despite personal disagreement. Which ethical principle applies? A. Justice. B. Autonomy. C. Fidelity. D. Non-maleficence. Answer: B. Autonomy. Rationale: respecting patient decisions, even when different from the nurse's view, demonstrates autonomy. Strategy: respecting independence equals autonomy. Question 35. A nurse comforts a dying patient by holding their hand. This demonstrates A. Fidelity. B. Beneficence. C. Veracity. D. Justice. Answer: B. Beneficence. Rationale: compassionate, supportive care promotes well-being. Strategy: showing kindness or comfort, beneficence. Question 36. A nurse double-checks the dosage before giving a high-alert drug. Which principle is followed? A. Justice. B. Beneficence. C. Non-maleficence. D. Fidelity. Answer: C. Non-maleficence. Rationale: preventing potential medication errors aligns with do no harm. Strategy: preventing harm or injury equals non-maleficence. Question 37. The nurse tells a patient the truth about a poor prognosis even though it's difficult. Which ethical principle applies? A. Fidelity. B. Veracity. C. Beneficence. D. Justice. Answer: B. Veracity. Rationale: ethical practice requires truth-telling with compassion. Strategy: truth-telling equals veracity. Question 38. A nurse provides the same level of care to a homeless patient as to a wealthy one. Which principle is shown? A. Justice. B. Fidelity. C. Autonomy. D. Beneficence. Answer: A. Justice. Rationale: fair and impartial treatment for all patients represents justice. Strategy: equality of care, justice. Question 39. A nurse stays after her shift to ensure her patient receives continuity of care. What principle is applied? A. Fidelity. B. Non-maleficence. C. Beneficence. D. Accountability. Answer: A. Fidelity. Rationale: keeping commitment to patient care represents fidelity and dedication. Strategy: keeping commitment equals fidelity. Question 40. A nurse allows a teenage patient to refuse treatment after explaining the consequences. What principle applies? A. Autonomy. B. Justice. C. Beneficence. D. Veracity. Answer: A. Autonomy. Rationale: respecting the patient's right to choose, even when disagreeing, demonstrates autonomy. Strategy: respecting choice equals autonomy. Question 41. A nurse admits to forgetting to change a patient's dressing and immediately corrects the error. Which principle applies? A. Fidelity. B. Accountability. C. Non-maleficence. D. Veracity. Answer: B. Accountability. Rationale: acknowledging errors and taking corrective action shows accountability and honesty. Strategy: owning responsibility equals accountability. Question 42. When the nurse informs a patient about alternative therapies, this shows A. Justice. B. Autonomy. C. Beneficence. D. Veracity. Answer: D. Veracity. Rationale: truthful disclosure promotes informed consent and patient trust. Strategy: providing full info. Veracity. Question 43. A nurse refuses to discuss a patient's condition in the hospital cafeteria. What principle is upheld? A. Justice. B. Veracity. C. Confidentiality. D. Fidelity. Answer: C. Confidentiality. Rationale: discussing patient details in public areas violates privacy laws and ethics. Strategy: privacy protection equals confidentiality. Question 44. A nurse uses ethical reasoning to choose the best pain management plan for an elderly patient. Which principle is used? A. Beneficence. B. Justice. C. Autonomy. D. Fidelity. Answer: A. Beneficence. Rationale: selecting actions that promote patient comfort demonstrates doing good. Strategy: promoting comfort equals beneficence. Question 45. A nurse supports a patient's decision to stop life-sustaining treatment. This is an example of A. Justice. B. Non-maleficence. C. Autonomy. D. Beneficence. Answer: C. Autonomy. Rationale: respecting end-of-life decisions upholds patient independence and choice. Strategy: respecting refusal of treatment. Autonomy. Question 46. A nurse refuses a gift of money from a patient. What principle is upheld? A. Fidelity. B. Justice. C. Integrity. D. Beneficence. Answer: C. Integrity. Rationale: accepting monetary gifts can create bias. Maintaining integrity prevents ethical conflict. Strategy: avoiding conflict of interest. Integrity. Question 47. A nurse reports an unsafe staffing ratio to administration. This action demonstrates A. Fidelity. B. Beneficence. C. Accountability. D. Advocacy. Answer: D. Advocacy. Rationale: advocating for safe conditions protects patients and upholds professional ethics. Strategy: speaking up for safety equals advocacy. Question 48. A nurse provides clear discharge instructions using simple language. Which ethical principle applies? A. Veracity. B. Beneficence. C. Autonomy. D. Justice. Answer: A. Veracity. Rationale: giving accurate, understandable information fulfills the duty of truth-telling. Strategy: clarity and honesty. Veracity. Question 49. A nurse questions a physician's order that seems excessive for the patient's condition. What principle is the nurse demonstrating? A. Accountability. B. Justice. C. Fidelity. D. Beneficence. Answer: A. Accountability. Rationale: questioning unsafe or inappropriate orders protects the patient and reflects professional responsibility. Strategy: speaking up for patient safety. Accountability. Question 50. A nurse refuses to administer a placebo without patient knowledge. Which ethical principle is demonstrated? A. Autonomy. B. Justice. C. Veracity. D. Non-maleficence. Answer: C. Veracity. Rationale: administering a placebo without consent is deceptive and violates truth-telling. Strategy: avoiding deception equals veracity.